So we're performing some full face fractional CO2 laser resurfacing today, and we've done around her eyelids and also the first pass close to the border of her lips. We've done that as well. And you can see as the laser goes, it fires in a random pattern, which we can adjust if we want to. But right now we've got it firing randomly, and it makes these little white dots everywhere the laser fires. When it does that, it's drilling little microscopic holes into the skin. Occasionally those little holes will get a little bit of pinpoint bleeding. In this case, she's not getting much of that yet, but she may here in just a little bit. And we just work our way across the skin surface, and it's okay to have a little bit of overlap. We want to do that so that there's not untreated areas. We're treating her on a 50% density level, so basically we're treating 50% of the surface area of the skin. That allows for normal skin to remain in place in between the treated areas, which speeds healing time and makes the recovery a bit easier. It also decreases the risk of any sort of complications like permanent pigment changes or scarring or anything along those lines. We're not going to approach any of those limits.